Dr. Sharda Jain, who has given who has given her valuable time for this WebEx, and she has agreed to share typhoid management related to vaccination part. So, on the behalf of Rabat, my name is Bharat Soni. I welcome you all the doctors who has participated in this meeting and is giving their valuable time. And again, I thank you, Dr. Sharda Jain. This is just I wanted to say. So I hand over the session to you. Thank you so much. Thank you.
Yes, Meenakshi. Good afternoon, everyone. Welcome in the Delhi Gynae Forum webinar today. And the topic today is typhoid vaccination. It's a single dose. Just sharing my slide. Yeah. So today we have a talk by none other than Dr. Sharda Jain ma'am herself. She's taking a typhoid vaccine single dose lifelong immunity, which is a new vaccine on the horizon, which is going to tackle us with the enteric fever basically today. And we have the moderator with us, Dr. Jyoti Agarwal ma'am. Ma'am is advisor Delhi Gynae Forum East. Dr. Deepti ma'am will be joining us soon. Ma'am is the Vice President of Delhi Gynae Forum East. And Dr. Renu Chawla ma'am is Joint Secretary is Delhi Gynae Forum. Ma'am will also be joining soon. And Dr. Seema Gupta, Treasurer of Delhi Gynae Forum East. I will cut short this. I'll hand over my mic to Dr. Sharda Jain ma'am for the talk. Over to you, ma'am.
Yes. Thank you, Dr. Meenakshi. Firstly, on the behalf of the Delhi Gynecologist Forum, we definitely mourn the demise of General V.K. General Rawat and so many top military officers. We feel very sad about it. I think the whole country is with them. And today I'm going to talk about typhoid vaccination. आप कहेंगे कि 6 महीने पहले तो मैडम आपने ये talk ली थी, then why this particular talk again? So I think, you know, over and above what I had talked last time, it is definitely a revelation for myself. And I feel, I repeat again, after clean drinking water, vaccination is the next one to clean drinking water in preventing diseases. There are 27 diseases which have been where the vaccine is available, and you find that the prevention is in the tune of something like 80 to 100%. And I think it will be good that all of you go through that particular history of vaccines, and you'll know it for yourself that promoting vaccine in any society is very much needed. And I think, you know, thanks to this COVID times that, you know, people have become more sensitive about it. And the ordinary person also realizes the importance of vaccination. So, और हमारे जैसे लोग तो कोई भी चीज के पीछे पड़ते हैं तो हम लोग मैं तो पागलों की तरह से पड़ जाती हूँ. So that's why people know me by vaccine woman. So this is another vaccine which I have taken a fancy for it, and I'm sure a couple of things you will come to know about thing. Let me just take a minute for sharing it. So you will not find this particular topic like this, typhoid single dose lifelong immunity. But I think, you know, once I unveil this particular findings, you will find it very interesting. Typhoid vaccination, this is based on the WHO guideline 2018, and it confers, the latest vaccine confers something like lifelong immunity in good 85% of people. In March 2018, guidelines replaced 2008 guidelines once the new generation, 4th generation typhoid conjugate vaccine came in the world market. We all know, as far as the typhoid fever is concerned, that this infection is only found in humans. And we all know about this particular infection caused by the Salmonella typhi and Salmonella paratyphi. Clinically, it is characterized by typical gradual continuous fever for 3 to 4 weeks. And we also know that, one of the typical feature is relative bradycardia with involvement of intestinal lymphoid tissues, reticular endothelial system, and involvement of gallbladder. And it may occur sporadically, epidemically, endemically. As far as we are concerned, you will find alarming figures as far as our country is concerned. Now you can see the global burden of the enteric fever. It is concentrated in India and Indian subcontinent. We are the main source. There are 2 crore cases take place annually, and there are 2 lakhs deaths, amounting to 2% deaths. We also see that the recent review which has brought about the incidence of typhoid in India is approximately 3.4 million, that is about 34 lakhs cases, which would amount to 30% of the global burden. And high burden in the subcontinent is further compounded by high prevalence of antimicrobial resistance typhoid salmonella. I will dilate on this further. And you can see here the significant morbidity and mortality is reported due to typhoid fever, and this is more prone in a younger people. It is not a problem of the Western world. USA sees 300 cases only per year. And that also the travelers which are going back to their home country, where especially coming to the India and Indian subcontinent is, that is the time that they are advised to take this particular vaccination. And whatever infections they get, more than 80% are typhoid, and 90%, more than 90% are paratyphoid. Now, as for the typhoid fever challenges are concerned, we find that the global burden is around 11 to 21 million cases, around 2 crores, and the deaths, which are 2%. The children are disproportionately affected by typhoid fever, with peak incidence known to occur in individuals aged 5 to less than 15 years. I again repeat, it is mainly a problem of children. It does not mean that the adult, it does not happen. I remember my MBBS days that you could get the spontaneous enteric perforations as a result of typhoid fever. Glad, those days are gone. Now, another problem which is that multiple drug resistance typhoid fever has emerged in the last 15 years. And the incidence has increased almost to from 35% to 66% in 2005. And the mortality, which is said to be 2% with this particular fever, once it is drug resistant, it rises to something like 7 to 16%, much higher than ordinary typhoid patients. And similarly, there will be increased incidence of complications along with mortality is there. Now, another thing is that, there's the emergence of this, which I was talking about, is the multiple drug resistance. In US also, where it is very infrequently seen, hardly 300 cases in a year they see, they also find that there are majority are cases which are resistant to fluoroquinolone antibiotic, which is the #1 drug, first drug of the choice. The trend over the last few decades and the recent outbreaks of cephalosporin-resistant typhoid fever in Pakistan and many other places also demonstrate that the importance that the doctors must understand what is the local resistant pattern in their area and what is the appropriate antibiotics to be given in case if they encounter a patient of typhoid fever. Now here I just wish to summarize, because in the last presentation of mine, if you will go through it, you will find that I had summarized the treatment in detail, but this is just to recap in a form of a slide. If you start a prompt treatment, it prevents complication and the case fatality rate is less than 1%. The local susceptibility of the drug to Salmonella typhi and the paratyphi must be known by every doctor working in that particular area. Fluoroquines are the most effective and they have a cure rate of something like 98%, but relapse rate does occur, which is seen in nearly 2% of patients. The ciproflox is the drug of choice, and oflox is equally effective. In resistant cases is common in India too, and there you find that this cephalosporins like ceftriaxone, cefotaxime, cefixime, or azithromycin can be other drug which can be used. Again, one need to know what is the sensitivity around, and the people even suggest that one can use a higher dosage of ciproflox. That is, instead of 500 BD, one should use 750 milligram BD for 10 to 14 days. Now, this is a question to all of you. This slide I have posed. You need to tell me, anybody can say, which of the following is accurate regarding the treatment of typhoid fever. The treatment should be initiated only after confirmatory test. Second is, cholecystectomy is almost always successful in eradicating the carrier state. Third is, uncomplicated typhoid fever should be treated with ciproflox, and ceftriaxone may be indicated for complicated typhoid fever. Which of these four statements I have done, which is right and which is wrong? Anybody?
Fourth one, ma'am.
In fact, let me be very frank. Anybody else also wants to try it out? In fact, to be very frank, all four statements are correct statements. So there is nothing which I can pick up which is wrong statement. Now we need to know what is the what the percentage of typhoid fever become carriers, and what is recommended age and the dosage of this conjugate vaccine. Chronic carriers are seen in 2 to 5% cases who have had a typhoid infection in the past, and the treatment in such cases is, if you find them, give them a ciproflox, but that treatment has to be continued for 4 weeks. And eradication is seen in good 80% of patients. And if they are persistent, in spite of all medical treatment, if it is not going, the cholecystectomy is recommended in such cases. Now coming to vaccine. Now you can see there are different type of vaccines and how they have evolved. The first generation had been inactivated one. The second generation is the live oral vaccine, which is very much used in US still. And the second generation is V1 polysaccharide vaccine. And this is again a vaccine I was surprised that still in America, this particular vaccine is used. Again, I tell you that, they do not have the problem. Typhoid is not the problem with the Western world. The third generation has been V1 polysaccharide conjugate vaccine, and finally is the paratyphi conjugate vaccine. Now, this is the three main types are, one is a typhoid conjugate vaccine, unconjugated V1 polysaccharide vaccine, and a live attenuated vaccine. As you can see here, that this is the only vaccine which is available with us. This oral is also not available with us. This is the only vaccine which is the fourth generation vaccine is available with us. The difference between the polysaccharide and the conjugate polysaccharide is that it is T-cell dependent immune response, which is there in polysaccharide, it is not there, while in a conjugate polysaccharide vaccine, it is there. Immune memory is not there in a polysaccharide, and while in conjugate polysaccharide, it is yes, and that is the reason that, it gives a lifelong immunity. Effectiveness less than 2 years is conjugate polysaccharide vaccine is effective. And as far as the efficacy is concerned, conjugate polysaccharide vaccine has a high efficacy. And the post-booster immune response is said to be robust, in fact, in both. IgG class switch is efficient as far as conjugate polysaccharide vaccine is concerned. So the typhoid conjugate vaccine, the salient features are it is a proven safety and a more effective than polysaccharide vaccine alone. It induces high antibody titer in children less than 2 years of age also, produces T-cell dependent immune response, which creates vaccine immune memory, and T-cell dependent, which induces V1 antibodies that neutralizes V1 antigen and may provide long-term protection, and a conjugate will not induce hyporesponsiveness in subsequent, if any other vaccine is being given in such patients. World Health Organization about the typhoid vaccination, which came in 2018, says that a single vaccination can give you a lifelong efficacy of 85%. Very easy to understand by all of us who have had a Covishield vaccination. It was told in the beginning itself that it is going to give you not 100% efficacy. It is effective in good 85 to 86% of patients, which means in case 15% will not be protected, and the people who are 85% also, if there is a infection is too big, we will present with infection. So many of us who have had 2 Covishield vaccination also, once this tsunami of the second lehar came, all of us got involved. So it depends upon what is the impact is there. And the similar thing is being told about the typhoid fever also, that in spite you have taken a vaccine, if the load of the typhoid organism is too much on you, you may present in spite of the vaccination. So this is, I think, very easy for each one of us. Please mute all of you. I think things become very clear for you. So always remember, whenever you talk about typhoid vaccine, then it is single vaccine. It gives a lifetime efficacy of 85%. It does not mean whenever there is a severe infection that you will not present with the fever, but then it will not be killing fever as is found in a patient, people like COVID cases. That gives a lifelong immunity. COVID, we have all started taking a booster. So as far as these vaccinations concerned, they have to be taken repeatedly. Now, WHO position, this is conjugate vaccine is preferred at all ages in view of its improved immunological properties, used in a younger children, and longer duration of protection. TCV should be prioritized in countries with a high burden of disease like India, or antimicrobial resistance, which is again seen very much in our country. As for the dose of this particular vaccination is concerned, the WHO recommends 0.5 ml single dose of TCV in children from 6 months onwards, in adults up to 45 years. What has happened? In endemic regions like India, WHO also encourages routine programmatic administration of TCV to children at the same time as other vaccines, that is at 9 months or in the second year of life. The adults like you and me should also take it. According to WHO, the primary vaccination means higher and a more sustained level of immunogenicity will be seen with this latest vaccination of typhoid fever and with one dose itself. The WHO recommends TCV as a single dose for 6 months to 45 years in endemic countries. As for the children are concerned, it encourages the routine administration of TCV at the same time as any other vaccine you can give with other vaccines at the 9 months of age or in the second year of life. Here I wish to remind again that you can take a multiple vaccination given on the same time, on the same day. But once you have taken one vaccination, you can't take second vaccination on the second day or third vaccination on the 5 days. Whatever vaccination you want to take, you can take in the similar day. Otherwise, the gap of 15 days has to be maintained between the 2 vaccinations. As for the catch-up vaccinations are concerned, the people who have not taken it earlier in the first year and the second year of life, they can take it up to 15 years of age is recommended, as a burden with disease is definitely much more in children than in compared to adults. WHO very specifically emphasizes that vaccine use in outbreaks and in emergency settings, they can be revaccinated. Otherwise, revaccination is, as far as the revaccination is concerned, the unwritten understanding is that this particular vaccination is not to be repeated. What is the contraindication of this particular vaccine? The only and absolute contraindication to vaccination is history of a severe local or systemic reaction following any other previous vaccination. As for the pregnancy is concerned, it is not a routine vaccination. I'm making it clear. The company also has not done any studies in pregnancy, but it is safe to be used during pregnancy since it is a bacterial component and not a live vaccine. The typhoid vaccine available in USA has not gone through any studies in pregnant women because it's a rare problem there. So they have not done any study. As for the UK guidelines are concerned, the typhoid vaccine, they are very clear, are given to reduce the risk of person catching typhoid. So the UK guidelines recommend that a pregnant woman should ideally avoid traveling to areas where the typhoid is common. But if you can't avoid traveling in those areas, they should take the vaccination. When deciding whether to have a typhoid vaccination during pregnancy, it is important to weigh up how high your risk of catching typhoid and the known risk of typhoid infection against the possible but unconfirmed risk to you or your baby of being vaccinated in pregnancy, some of which might depend on how many weeks pregnant you are. It is not a routine vaccination anywhere in the world in pregnancy. According to WHO, the countries may consider routine use of VIP vaccine in those more than 2 years or oral vaccine for those more than 6 years. And when I was reviewing the data, I was surprised to find that these are the two vaccines which are used in US. So in US, the vaccine which are given are oral. It is it is oral live vaccine, or it can be given attenuated vivo-tiff, 1 capsule every other day, and these are 4 doses. If injectable has to be given, vaccine has to be given, it is V1 capsular polysaccharide coming by the name of Typhim V1, and again 1 dose subcutaneously is given. This is the vaccine which is used in USA. You can give, there are 2 oral vaccines and 1 is injectable vaccine. 1 dose is advised for a lifetime. These 2 vaccines give an efficacy of 70% and they are not protective against the paratyphi disease. Now, as far as the Indian Academy of Pediatrics is concerned, the single dose of any typhoid conjugate vaccine is recommended from 6 months onwards and can be administered with other vaccines. CDC says if you are traveling to a country where the typhoid is common, you should vaccinate yourself. The WHO says the same thing also, that the people who are traveling in a high-risk area should take the vaccination. As far as the Association of Physicians of India recommendations are, that TCV is preferred at all ages because of its improved immunological properties and expected longer duration of protection. And that is why, almost it is said that it is for lifetime. Professional food handlers should always be advised to take this particular vaccine. Typhoid patients after full recovery from illness can take the vaccine, and that is 4 weeks after the complete recovery. It is recommended for travelers or during outbreaks. TCV dose is 0.5 ml intramuscularly single dose, and the booster dose is not needed. But we must remember that the typhoid infection costs you money, whether you're treated from outdoor or whether you're hospitalized. It is estimated in 2016 that if you're getting treated in the outdoor, the average Indian spends something like from $20 to $75. Well, in case if they're hospitalized, it works out to be anything from $200 to $630 in India. In India, anybody who gets admitted. So it is always wise to take a typhoid vaccine, and in today's time, single time you will take it, in 86% or 85%, it will provide you lifelong immunity. And I again repeat, the people have had a fever, typhoid fever. After recovery, they can take 4 weeks after the recovery, they can take the typhoid vaccine. Now, how to vaccinate adult vaccination? Again, I'm trying to repeat it again so it rubs in your brain that immunizing those for adult and children more than 6 months is 0.5 and the booster is not recommended. As for the children is concerned, I'm emphasize again from 6 months to 15 years, the dose is 0.5 ml and the booster is not recommended. Though it is said booster can be given after 3 years, but the practice by all pediatricians is that they are only giving 1 dose. So frequently asked questions by your patients, how effective it is. Effectivity is to the tune of 86%. With a single dose, lifelong immunity is expected. And how long after the typhoid disease should vaccination can be given? That is 4 weeks after the full recovery. So the take-home messages are that the TCV is a safe and immunogenic, prevents more than 85% of typhoid fever cases, and these calculations of the vaccine efficacy within the confines of a stringent laptop really went off. And this is what I wish to tell you. The take-home messages are what you should do. I will say take yourself. Give to your staff just like hepatitis vaccination. Give to young girls, especially who are going to get pregnant tomorrow, and people are very fond of taking golgappas here. I find, this should be recommended to at least young girls who are fond of eating chaats outside. And it should be given to food handlers in your hospital, anywhere whom you know the food handler should definitely take it. Just like as we advise we advise hepatitis vaccination to our staff. I think similar way, any food handler, you should definitely see to it that it's, especially if the cook is coming in your place, you should see to it that the typhoid vaccination is given to such people. And I again remind to all people who are watching me and seeing me is that it is India's problem. And Indian doctors have to come forward for guidelines. It is not an America's problem, and it is not the problem of the Western world. And this is what we need to take a call. And this is I could add, as for the typhoid fever is concerned, that I could add something which I had not touched last time. So that's what about this. Thank you for patient hearing as far as this presentation was concerned. Thank you very much.
Thank you very much, ma'am, for enlightening your presentation. And we do have this trick fever in our country, which is endemic, and we need all should be vaccinated so that we don't suffer this disease. I invite expert comments from Dr. Deepti or Dr. Renu Chawla, ma'am.
Dr. Seema, what do you have to say?
Dr. Seema, please.
Yes, ma'am. Thank you so much for this wonderful talk. We definitely need a revision every time. Unless we revise, we forget. And prevention is definitely better than cure. So vaccination is the need of the hour and the future for our country to prevent the disease burden for our country.
Yes. Madam, 2 crores cases from India and 2 lakh people die every year. So I think, 1 vaccination need to be given, and it is for lifetime. So this is what my advice to everybody who's listening me.
Yes, ma'am.
Yes, definitely. और स्पेशली अगर आप गोलगप्पे खाते हो तो जरूरी आपको लेना है.
Everybody will have to take them.
Dr. Vanna, ma'am, you want to say something? Dr. Vanna, Dr. Deepti ma'am, Dr. Renu Chawla ma'am, or we move ahead with the second presentation.
Vaccination is a must.
Yeah, vaccine is, yeah.
Because people
vaccination of each and everyone is a must.
Vandana, you continue, I'll say later.
Yeah, okay, sorry. Yeah, no, vaccination for any disease, and that too, this disease is carrying so much of morbidity. Not only mortality, we are talking of morbidity also. Long-term morbidity is there, and people keep on suffering and keeps on coming back and back because the reservoir keeps on, the reservoir is there in the body. And that is the reason why the typhoid fever keeps on, the people keep on having relapses. And this is a single shot which is very encouraging. And a single shot giving a lifelong immunity would be a godsend opportunity for all of us. That's
and
all
we are lucky that we have the latest vaccination available in our country. It's the latest vaccination.
Yeah.
Not only latest, we have at a cheaper cost also than the rest of the world. One thing is that, and another thing is we have seen so many people in pregnancy having intestinal perforations and long-term morbidity with this kind of a fever. So it's better to take precautions and vaccinate themselves rather than getting into chronic disease and complications.
I just wish to tell you is also that, as far as this vaccination is concerned, it is safe because it is not live, it is attenuated. So it is not been prescribed by WHO or CDC because it is not the problem of the Western world. It's a problem of we people. So this is what the message must go, that if anybody wants to decide about it, that the vaccination need to be given, it is good to give. In pregnancy में थोड़ा सा ये लगता है कि कहने तो से पहले तो जरूरी दे दो डॉक्टर साहब.
Yes.